When we last spoke with RN Patti Spaar, she had just been appointed the nursing manager and general director of the Highland View Health and Wellness Center. Now, in an exclusive second interview, we're asking the hard-hitting questions that other nursing journalists just don't dare to touch. Welcome to this week's segment of Leadership in Healthcare. Hello, and thanks for tuning in to this week's segment of Leadership in Healthcare. Today we have with us once again RN Patti Spaar. She runs the Highland View Health and Wellness Center, and today she's here to talk to us about some new happenings at the center. So, Patti, can you tell me what is new at the center?
Well, first of all, thanks for having me again. Like I was saying before, we were looking to bring in a palliative care team to our center, and that's exactly what we've done. We've brought in a palliative care team to assess our clients that are having chronic illnesses, and we're trying to help them live healthier lives.
So what exactly is palliative care, and how is it different from hospice care?
Okay, I'm glad you asked that. Palliative care is really symptom management for chronically ill patients living with long-term, oftentimes debilitative illnesses. Diseases such as diabetes, COPD, congestive heart failure, arthritis, and even hypertension are diseases that have long-term effects and people live with for a very long time. Palliative care offers symptom management, both from their physical symptoms, such as pain, to the psychological suffering that goes along with having debilitating illnesses. It's essentially care that's given to alleviate the symptoms so that the people can live more productive lives as they age. It involves having the patient understand their illness and how to best manage it. Many people under palliative care will continue to pursue curative treatments, so the palliative care providers are just there to help them be more effective. Unlike hospice care, which is really end-of-life care, it's provided for people that have less than 6 months to live and really focuses on providing care and relief as patients are in their last days. One of the leaders in the medical field stressing the effectiveness of palliative care is Dr. Diane Meyer, and I like the way she just stated it very simply by saying hospice is a form of palliative care for people who are dying, but palliative care is not about dying. It's about living, and living as well as you can for as long as you can.
So who can benefit from palliative care?
Really, anyone living with a chronic illness or even a terminal illness can benefit from palliative care. We like to say that we involve families as clients as well, because families undertake a lot in helping their loved ones cope with chronic illnesses, so we help them also. It's currently estimated that there are 6 million people in the United States that could benefit from this type of care, and statistics show that by the year 2030 there could be as many as 70 million senior citizens making up our population. Palliative care can be given to inpatient hospitals, patients on an out-care basis, even as part of home care. In our facility, we bring our clients in. They're there for certain things like exercise therapy or stress reduction classes. And now, with our new palliative care team, we can bring them in to meet with a group of healthcare providers.
All right. Is there literature that addresses the effectiveness of palliative care for chronically ill patients?
There is. A study that was conducted in 2010 looked at 34 different organizations and their practice and ethics involving palliative care. Of the many responses obtained, symptom control, primarily pain, was viewed as the most important by patients, doctors, and nurses alike. It was also shown that having a team consisting of doctors, nurses, social workers, and therapists taking the lead, that symptoms were managed more effectively and patients and their families reported better outcomes. One interesting thing as a nurse that I was excited about, that nursing involvement was shown to be a vital part of the success of a palliative care team. Palliative care really is a model that is very consistent with basic nursing values, as we've known them for, as long as nursing's been around. We care for patients regardless of age, culture, socioeconomic status, for an undetermined amount of time.
All right. Well, what are the main concerns when addressing palliative care?
There are many main concerns. I'd like to say there's three main concerns. The first thing would be starting the conversation with the patient. We have to first get them to acknowledge that they need help. We bring their families into it, as I was saying before. We like to intervene by making sure they understand their illness and the possible course that it might take. We like to bring our patients into the goal setting process so that they can let us know how they want their care managed.
All right. Can you give me an example of a patient you have worked with and what you did for them?
Sure. Recently, I was part of a team that worked with an 86-year-old woman who was suffering from end-stage renal disease, congestive heart failure, and had a recent diagnosis of lung cancer. We came together at the request of her primary care physician to address her palliative care needs. The first intervention, again, was to have that conversation with her, which we did. We stressed that we will continue to reassess the situation as her disease process progressed. Next, we addressed her pain. She, like many people dealing with chronic illnesses, say that pain is really the biggest problem. We set goals for medication use, relaxation therapy, and holistic methods. She was very interested in different holistic methods, so we did that. Lastly, we made sure that she understood how to effectively communicate with her doctor. We don't want the doctors taking the primary role in the healthcare. We want the patients to be able to make their own decisions. So we introduced her to the process of filling out an advance directive and a power of attorney. While this conversation is going on, a patient develops a sense of empowerment over the situation because she's now part of the decision-making process and understands more about her illness.
Okay, and how did those interventions work out for the patient?
Well, we always assess any interventions that we do at the center. We met 3 weeks later. The whole team got together and we had a conversation to see if the goals were met. First, the social worker reported that the patient did fill out an advance directive and understood the ramifications and actually noted that her daughter was her power of attorney in case there came a time that she couldn't make her own decisions. He also said that when the physician met with her and noted that the patient could explain to him what medications she was going to use and what new methods she was willing to try. She also let the physician know about when, if things progressed poorly, she would contact him. The patient at this point wanted to let the physician know that her goal was not to be in and out of the hospital any longer. She would really like to try to remain home as much as she could. I was fortunate enough to meet with her and we went over the medical order for life-sustaining treatment, or the MOLST form as we know it. She had filled it out and it now gave her doctor a set of instructions of her wishes for care. The family was very happy with how everything was progressing and we're just pleased to have found this at the center.
Now, this sounds like quite the professional collaboration. Could you tell me some more about that?
Yes, sure. Again, as a nurse, I feel really good about being part of this dynamic team of healthcare professionals. We come from many different disciplines, so we obviously have different perspectives. That works really well for the patient. By involving the primary care, we definitely have a better sense of the needs of this particular patient. Our ultimate goal in palliative care is that the patient live a fuller life while dealing with these chronic illnesses, and that they can be prepared for things that come up. In addition to the immediate palliative care team, we like to get out in the community and involve other team members such as dialysis center technicians and even the transportation people that help get chronically ill people to and from their appointments. What I really would like to see as nurses going forward is that we continue to take the steps to specialize in palliative care so that we can fill the void left by there just really not being enough palliative care physicians out there.
All right, well, I have learned a lot of the palliative care and the relief it can provide for patients and families. I'm happy to know that this is now part of the care given at the center and look forward to hearing more about the progress you are making. Thank you so much for joining us today.
Thank you, Will.
This has been Leadership in Healthcare. Tune in next week for more investigative nursing journalism. Good night, everybody.